Good evening, everybody. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Shabir Pando. You may know me. I am the leader of the council, and I'm really pleased to join you. And I'm really thankful for everybody who's actually taken the time out to join in this evening's webinar. Firstly, let me pay tribute to the wonderful work that you have all been doing. You have really stepped up to the mark. 23rd of March was a key date when we went into official lockdown. But I know many of you were actually working way before in trying to actually help your communities and help the wider community and help the council in what we were probably going to enter into, which we know we are now, the most difficult crisis that we have ever known. The virus is still very dangerous, it's still very potent, and despite the partial easing of lockdown, the virus is still very alive and kicking. We have worked really hard with all the communities, and I pay special tribute to the ulamas, the priests, in your synagogues, in your mosques, in your temples, and in your masjid and madrasas. And I really welcome the hard work that you've been doing. And the voluntary community sector, the way they have mobilized and actually become part of the heartbeat of what we're doing and the arteries of our infrastructure is really well appreciated, and we hope we can carry on that good work moving forward. Lives have changed, lifestyles have changed, and unfortunately my heart goes out to lives lost. Excess death planning was something that we had to prepare for, and again the way all faiths organizations have actually pulled together and actually worked with the council in such tragic circumstances. Because this is not a situation where anybody would like to be in. Normality is still something in the distance, and whatever the new normality will be, we don't know. Each day the guidance changes, and I'll talk about the guidance later on because I'm sure you want to hear what's happening so far. But we've actually stepped up, and not just local government, because where guidance has been short from central government, local government has stepped up. So I'd like to thank all our officers, but at the same time, the communities have stepped up. And that really is a tribute to you people working within the faith sector in whatever capacity, because you have stepped up. If you did not step up, we would not be in a position where we can actually proudly say that we've actually managed our best. And that's all we can ask anybody to do, try your best. Key workers have actually mobilised themselves in a way that we would have never imagined. Not just the NHS, but our care workers, our bin workers, and all the frontline staff that have been doing some wonderful work. The purpose of this meeting is just to clarify the position regarding places of worship, because there's been a lot of Twitter feedback going on. There's been a lot of news articles on the BBC website, and generally speaking, there's been a lot of confusion. So just to be absolutely clear. So we go away, reasonably assured. The guidelines are still in effect until Monday, because whatever the guidelines are will not be in effect until Monday. So we are at this position in terms of Regulation 7, which is part of the Coronavirus Act, that in private or public places, you cannot gather more than 6 people. And even if you do gather in public or private spaces, you have to social distance, which is 2 meters. So that is still intact. What may happen on Monday, and again the guidance isn't out yet, is if people want to go to their places of worship, they will be able to do that, but that will still be on an individual basis. So there will be no communal led prayers by priests or imams or reverends or whatever the religion you follow, rabbis. That communal get together, that communal prayer is still not allowed under the government regulations. So it's very much you've got to do your own remembrance of whoever you believe in whatever setting you believe is right for you. So the guidance will be out on Monday, but like everything else, we will find out most likely on the 11th hour. We don't know what the guidance says. As soon as the guidance is out, most likely on Monday, what we will do is we will get something out to you as soon as possible, and we'll try and answer as many questions as we can We'll try and get some, a guide to make you aware of what we can do and what you can do and what we expect. But I think the bottom line is is the way I look at it is you're all responsible people and you've all really stepped up to the mark in a way that we could never ever imagine. You know your communities, and most of the communities that have asked questions come from a BME community or a deprived or representing areas of poverty. And we all know that the facts are there in terms of the public health report, that if you are from a BME community, you are 4 times more likely to die. Luckily, the part of the world I live in, North Kirklees, the deaths are literally very minimum. That is only possible because of the hard work and the commitment of each one of you has made in terms of keeping your congregation safe, keeping your community safe, and making sure that you actually socially distance, right? Yeah, and the message is passed on. What I don't want to do is, despite whatever government guidance comes out, we don't want to be in a situation where there is an outbreak at a local level in a locality, in a particular area, where people live very closely together. They may be extended families. And we end up in a situation where the excess deaths that were predicted actually do start to materialize, because we have had excess deaths, but they have not been to the same extent that we were fearing. But the threat is still there. So we want you to bear that in mind. Whatever decision you make, I'm sure you will make in the best interest of the community, your congregation, and humanity at large. There will be more conversations like this. This is not the first of the series of conversations we want to have. We want to try and make sure that we actually engage more. We want to make sure we listen to you more. We won't have all the answers today, but we will try and get you as many answers as we can. There is still recovery to take place, and there will be impacts, not least around the stuff that you're doing, but there will be also economic impact. And I understand that faith plays a very important part in the life of the well-being of the individual. Because if people become unemployed, they'll want some spiritual guidance, and I understand that, and that's where we want to make sure that we provide all the support we can give you in terms of how you can support your communities, and that's why we want to make sure that whatever we do, we use the faith-based sectors in the best way possible, and I'm sure we will all raise up to the challenge. So what I will do is I'll just introduce you to the people I've got on the panel. I've got Mel Meggs, who's the Strategic Director for Children and Young People. I've got Rachel Spencer Henschel, who's our Strategic Director for Public Health. And then I've got Jane O'Donnell, who's the Head of Public Health and Protection. I've got Wendy Blakely, who's the Head of Public Protection. And one of my Cabinet colleagues, Councillor Carol Patterson, who's got a hand up, who's the portfolio holder for young people, children and communities. So without further ado, what I will do is I will pass you on to Rachel Spencer Henschel, and she may bring in Jane O'Donnell to give you an update on the public health agenda. Rachel, over to you.
Okay, thank you very much, Leader. So as the Leader said, my name is Rachel Spence-Henschel. I'm the Director of Public Health for Kirklees. I just want to support the Leader's comments in relation to saying how brilliant it's been in terms of how people have responded to this crisis, and certainly the reason that we have one of the lowest rates of infection, I think, is testament to people adhering to those guidelines and really taking that stay-home message to heart. I just wanted to give you a bit of an overview of kind of the picture of Kirklees and how it's played out over the past 12 weeks, just so that you get a sense of where we are in the outbreak. We've had obviously a process of testing people that isn't a population-based test, so we're not testing everybody. We've probably been testing predominantly people who have been very poorly and those people in hospital. So at the moment we've had up to date 777 confirmed cases of COVID in Kirklees. We've had 507 hospital admissions, so that number reflects the fact that the people that are being tested are the ones that are very poorly. Sadly, we've had 280 people die who are residents of Kirklees of COVID. I think it's important that we articulate that we're moving into a different phase as we move into what's called test, trace and isolate, which I'll talk to you about in a minute in terms of how that works. I think one of the most important things as well to talk about is the fact that some of our population have had to shield, which means they're in a very vulnerable category and will have received, hopefully, support from both the NHS and the council to be able to stay at home and protect themselves to make sure that they don't catch the virus. There's also a list of people who are on a vulnerable list, which means that they have some of the conditions that mean that if you are going to get it, you're more likely to be poorly. So things like asthma and diabetes are on that list. At the moment, that vulnerable list is still maintained, and even though social distancing is being relaxed to a certain extent in terms of being able to meet more people outside your household, it's really important that you consider your personal risk in relation to those vulnerabilities. I think in terms of the cases, it's also important to say that we probably hit our peak in around mid-April. So actually, as we've come down, as we've come out of that peak, we're now seeing fewer and fewer cases, which is suggesting that the measures that have been put in place are working, which is why the government have started to bring back some of these relaxing of these social distancing measures. I think it's really important, though, to remember that the 2 metre rule is not an arbitrary calculation. It's something that's been looked at in terms of helping to minimise that risk of transmission. So maintaining that 2 metre distance whenever you leave your house is absolutely key. I will also say that hand washing for 20 seconds with soap and water still remains the easiest and simplest way to kill this virus. And I absolutely think it's important to say that glove wearing is not a helpful way of combating this virus. And the reason for that is if you're wearing gloves, it means you're less likely to have the opportunity to wash your hands. And actually, if you come in contact with the virus with your gloved hand and then you touch your face, the transmission is still there. So the gloves itself do not protect anybody from this virus. So it's really important that gloves aren't used as a way of providing a false sense of security in relation to this virus. You'll have seen that face coverings now are recommended in public places, and that we've put some helpful videos, hopefully you might have seen on our social media as a council, of how you can make those quite simply. But it's important to distinguish those face coverings from the face masks that are used in NHS and social care settings, because they're obviously for people who are providing direct personal care, and it's important that we maintain those stocks for people working in those roles. I just want to quickly touch on test, trace and isolate, because I think this is going to be something that we will need the community to get behind. So we're moving into a phase now where anybody can now get tested. There is a national testing portal, and we are encouraging anyone with symptoms to go and get themselves tested. You can book a test and you can go to various different sites to get tested, and including home delivery. What that test will do is you will be contacted with the result, and if it turns out that you're positive, you'll be asked to self-isolate for 7 days and your household for 14 days. What someone will also do is ask you about your contacts. So they will work with you to try and get a sense of who you've been in contact with whilst you're likely to have been symptomatic and shedding the virus, to try and then track where the virus has spread. So it's really important that when you are going out and about, you're thinking about who you're socialising with, so that we've got a better understanding of who you've been in contact with. By being in contact, what would happen is you'd get a call to say that you are a contact of a positive case, and you will be asked to self-isolate. Now, I know it feels like it's going to be quite hard for people to do that, but I think it's really important to remember that we know from the evidence that there are a number of people who are not showing any symptoms but are carrying the virus. So if you are a contact, even though you feel fine, it's important for you to self-isolate, because you might have had the virus but actually don't have any symptoms. Okay, I'm going to pause there because I think that's probably it in terms of some of the overarching stuff. Jane, can I just bring you in on terms of any more specific IPC advice that you want to cover?
It's really the IPC advice I will be giving is really, if the guidance comes out that private prayer is feasible from Monday, that when you enter a a building of faith, that you actually decontaminate your hands, clean your hands on entry to the premises and when you leave, and it's actually socially distancing within the faith building. So that makes ensuring that you're 2 meters away at all sides from anyone else. It's also about ensuring that you don't use like communal literature. So obviously, if you're going to take a prayer in, take it in yourself to read, but not using the literature what's normally within that faith building. And obviously, if once you leave the building, obviously you need to decontaminate your hands as well. Now, we do know that some people do not want to use alcohol and gel, so buildings may wish to use hand wipes, which may be a way of decontaminating the hands, because soap and water may not be easily accessible directly as you enter a building. So that is one way to use to decontaminate your hands. But the important thing is when you're in the building and there is other people there, that you are actually socially distancing, doing the 2 meter rule.
Okay. Do we want Wendy to come in now in terms of the specific guidance? Is that all right, Leader?
Yes, good idea. Wendy, you want to?
Thank you. Good evening, everybody. So as the leader said, from Monday the 15th of June, places of worship may open, but only be open for individual prayer. So it's not for any led services or any worship to take place which is led. It's for individual prayer only. And as Jane has pointed out, that's in line with social distancing once you are within the building. The whole purpose of it is to ensure that we don't spread the virus, as Rachel has pointed out. That's really important, that we maintain the good levels of infection that we've got at the moment. So the purpose for opening the places of worship is to support people's health and well-being, because we recognise, as a leader said, how important it is for everybody to be able to take part in prayer. But at the moment, as from 15th of June, Monday, that's just for individual prayer and not for any led services. What we don't want to encourage is large groupings or large gatherings, because that would enable the virus to spread.
Could I also add that while in building, we wouldn't want people to be singing either, because that is actually where you could actually force out droplets of infection as well. So you may feel like you want to actually sing something which is part of your faith, but that is to be discouraged as well, please.
Right. Okay. Thank you very much. That was very informative and. Obviously, it's a moving feast. We will know more as the next few days go ahead. And as soon as we get an update, we will make sure that Mashuda, who's our officer who liaises with all faith-based communities, she's got your contact details and she will keep you updated. What we'll now do is we'll move on to item 4, which is there's been some really excellent questions that have been submitted. So what I will ask is Councillor Carol Patterson to ask the questions, and then the relevant officer will come in and hopefully try and provide some answers or some more information. Thank you, Carol. Over to you.
Okay, thank you, Leader, and good evening, everybody. I mean, this has all taken us a little bit by surprise, hasn't it? I mean, along with most of the announcements that have come from government, we get very little notice of changes that we're able to make. But one of the reasons we're all here tonight is to help you adjust to those changes, but also because by now we, as a council, we've got quite a bit of experience in being able to adjust to these changes quite quickly. We're opening schools, we're opening town centres, we're opening parks. There's lots of experience that we've got that we want to share with you and to help you, support you with opening your buildings. but as it's been said, and I will reiterate, it is for your individual members of your congregations, their emotional needs, and it is about personal prayer only, and it is still social distancing within the building. But that doesn't mean, and again I'm reiterating, you will have to make those buildings safe for people to enter, to be in, and then of course when they leave, they need to be safe for the next person coming along. So some of these questions, which I'll go through now, are about helping you to get your buildings and your congregations ready for Monday the 15th. So the first question is, can the council help with risk assessment and support us through the process? Is there a standard risk assessment for this situation? And I believe Wendy is going to answer that question.
Thank you, Councillor Pattison. So in relation to risk assessments, it is good practice to have a risk assessment written down. And in most cases, it will actually be a requirement to have one. Each place of worship we recognise will be different, and you will need to develop your own risk assessment. There is an awful lot of useful examples out there. I had a look this afternoon, and all the different faiths have got examples and guidance out there. So there's plenty of advice you can use out there for developing your own risk assessment. As the leader said, the government hasn't as yet issued any guidance, but we have been told that will come out next week. And the Health and Safety Executive are providing additional guidance as well regarding reopening of places of worship towards the end of June. When you are thinking about your risk assessment and writing it out, I always like to think, what's the purpose of this? You know, why am I doing this piece of work? And the purpose is, as you will recognise, is to stop the spread of the virus and to protect people. And as we've outlined, you know, there are vulnerable people within our communities, so we have to be particularly careful in relation to this. So the sort of things that you'll need to think of is starting off with the basics. So some of your buildings might have been empty for quite a long time. It might not have been used, so it's checking things like your electricity, your gas, running the water, flushing the system to prevent any build-up of Legionella and things like that. Thinking about how you're going to control the numbers of people coming into your place of worship. So as Jane said, anybody coming into the building, you need to ensure that social distancing takes place. And so looking at the different sizes of your building, some people will be able to have very few people in, might only be 1, 2, 3. Some people may be able to have more people in, you know, up to 10, but that, or up to whatever capacity the building can hold, bearing in mind that everybody has to have 2 metre distance around them the whole time. You'll need to think about training of your volunteers and what measures need to take place if people don't want to follow social distancing within the building. And think about identifying good practices, signs about hand washing, as Jane said, and think about the cleaning procedures, because frequent contact surfaces will need to be cleaned on a regular basis. There is lots of guidance out there about that, and we can send that out and send you the links to where that guidance is. Buildings should be well ventilated, and as we said, it's hand washing as you come in and as you leave the building. But we will send out any guidance that comes up once it comes out. And I think that's it. Thank you.
Okay, thank you, Wendy. The next one question is, can you update on how to open, how the building should be open, i.e. legalities, ages, sanitising, access to toilets and washing facilities? I don't know quite, is it Jane or Wendy going to answer this one?
Might be a bit of a double act, Councillor.
Yeah, I think so. Yes. Yeah. So it's a bit more of the specifics.
As I said earlier, obviously people need to be to ensure that they can actually clean their hands as they're going into the place of worship. They obviously, if access to toilets is required, but there again we have to look at again about the 2 metre distancing and the number of people what would be able to use those facilities at any one time. Also access to soap and water, paper towels for hand drying, ensuring that there's bins available for those paper towels to be disposed of, and obviously the cleaning of the toilet facilities is extremely important. So I'm sure all places of worship have a cleaning schedule, but it's really important that during these times that increased cleaning does occur. Obviously, as Wendy said, frequently touched surfaces need extra cleaning during COVID-19, and when individuals leave the building, again, should have opportunity to be able to clean their hands on leaving the building. As I said previously, it may be that you wish to use alcohol hand gel, which you ensure that you cover all the surfaces of your hand and your wrists, or hand wipes are another excellent alternative. But hand wipes, again, would need to ensure that there was a bin with a lid on so that those wipes could be disposed of safely as well.
I think the only thing that I'd want to add is walk through the building yourself, sort of walk the route that you think anybody would carry out when they're coming into the building, and look at where there may be areas where you might get pinch points where people might meet up, look at the seating arrangements and things like that. It's maintaining that 2 metre distance.
And if at all possible, if you've got an area where you could actually have an entrance and a different exit, that would help as well with the flow of individuals. So in case people were, then you didn't have people crossing, because obviously we do not want people crossing. We want to ensure we've got that 2 metre distance.
Okay. The next question, I think has been, we've already answered it, but I'll ask it again anyway, because it really does need to be reiterated, this. So the question is, so can we be open and people attend to pray alone, but not in congregation, i.e. 6 people? Jane or Wendy?
Do you want me to answer that? Yes. So
yes, go on. Yes,
it's as we said, yeah, it's for individual prayer, and it's not for led prayer. So there can't be any congregation and any prayers or worship like that. It's for individuals to go in and carry out individual prayer by themselves.
Okay. The next 2 questions I'm going to run together because I think they're very similar, and perhaps we can have the one answer to that. So first off, it's is there funding available from local authorities for places of worship to implement health and safety requirements? And similarly, can places of worship apply from to central government or the LA for hardship grants? So is there any hardship grant available, or any grant for health and safety requirements? And I think, Rachel, are you going to answer that one?
Yeah, I'll do my best. Thank you, Councillor Patterson. It'd be interesting to see when the guidance comes out whether there is any provision made around support in terms of implementing, because obviously it will have an impact in relation to potentially the additional cleaning and the additional measures that need to be put in place to allow that social distancing. It's something that certainly we can talk about in terms of whether we can do some influencing nationally on that. What I will say is that as a local authority, we've got many different sources of funding and grants that we are aware of that we can support people to access. So we'd be really keen to hear from you individually if you want some support in understanding what funding is available. Obviously, the important thing is to keep a record of what you're spending so that you get an understanding of what the impact of this has had, which has obviously been good practice throughout all of this, because there's been a huge amount of costs incurred that we weren't necessarily expecting. The government's been launching many different schemes in terms of relief around some of the impacts of COVID, so that might be again a funding pot that's available to you. So I think that would be an individual conversation to help to support you and direct you to where that funding may or may not be available.
Okay, thank you. Can I run the next two questions that I've got together, and perhaps I could ask Mel to answer these two. I mean, firstly, it's can we open as a supplementary school, and when can we open, and what would we need in place to ensure children are safe?
Okay, thank you, Councillor. So far, the government have decided that there are only two types of settings that are allowed to bring children together, and where those settings then will need to also apply a whole range of different social distancing measures. So those two settings are registered childcare settings, so those that are registered with Ofsted to provide childcare, and schools. So that's registered schools who are registered with the Department for Education and with Ofsted. So they're the only two places where children can be brought together for the purposes of care or education. At the moment, there has been no relaxing of the guidance for other educational supplements. So at the moment, we're not in a position to be able to give agreement or to support the opening of any other types of arrangements where children can come together. We are talking to the government about that. We are raising the issues because we do know that it's really important for children not just to receive their academic education, but their spiritual education is really important to them, particularly at times when we've had so much isolation. But at the moment, the government are being very specific, and particularly with schools, particularly with the secondary school sector, they're only agreeing for certain year groups to come back. We do expect this to be an ever-changing picture, and as soon as we're aware that the government are going to relax the rules around children coming together, we will let you know so that you have the time to plan for opening those settings. We've got some experience now because of the support we've already been providing to childcare settings and to schools around how you risk assess and how you manage to keep children safe in those settings. So as soon as the government says that you're able to bring children together for those purposes, we'll be able to share with you the guidance we've been able to provide for schools and childcare settings around how you manage groups of children safely. But until then, the government is saying that it is only for registered childcare settings and registered schools where children can come together. Thank you, Councillor.
Thank you, Mel. The next question that's been submitted, I think has already now been answered by Mel, but I'll just for the for completeness, because somebody actually has asked the question. The question was, for those madrasas who open from Monday by taking all precautions with the consent of parents and children to send their children, will they face penalties if they open and start teaching by adhering to social distancing? I mean, perhaps I will bring Mel back, but I think the answer is there. Of course, you've already had the answer to that one, is that unfortunately madrasas cannot open from Monday. But is there anything more that you'd like to add to that, Mel?
No, I think I just wanted to reinforce, I suppose, that we absolutely understand how difficult this is, and we are talking. I have twice weekly calls with the Department for Education. I have put on the agenda for the asking the DFE to consider the concept of providing guidance around madrasas, but up until this point, there is no allowance in the relaxation of the measures for madrasas to open. It's not just madrasas, but after school clubs that are not on school sites are also not allowed to open, and play schemes and other types of arrangements are also not allowed to open. So just to reiterate, there are two forms of places where you can bring children together in a socially distanced way, and that's for childcare, and you have to be registered with Ofsted for childcare, or for education, and that has to be on a school site.
Okay, thank you. And then the last question that I've got, and it's very sad, really. It's can small wedding ceremonies be held in a mosque, i.e. a nikah? I say sad in the sense that, unfortunately, I think the answer to that probably is no, but I don't. Who wants to answer that one? Rachel? Wendy?
Yeah, my understanding is at the moment the guidance is that weddings can't take place. We are expecting, I think, an announcement soon in terms of a signal as to when that's likely to be. But at the moment, no, weddings cannot take place, I'm afraid.
Okay, so that concludes the questions that have been submitted by different faith organisations before the meeting. I don't know, are there any sort of further words that any of the panel would like to give?
Mute.
Councillor Pandor, you are on mute.
Yeah, sorry. There have been some excellent questions that have come through on YouTube, and I think Rachel's picked them up. So Rachel, can I pass it on to you if you want to read them, and then the appropriate officer can respond? Thank you.
Yes, thank you very much, Councillor Pandor. There was a question that said that someone felt that the guidance has changed and private prayer is now permitted from Saturday the 13th. I have not seen anything in the official guidance that suggests that that is the case. So we are still working on the basis that it is Monday the 15th. There is another question regarding is there still age restrictions with regards to private prayers in place of worship? Now, I'll bring colleagues in terms of this. I hadn't seen anything that specified ages, but again, that might come out in more detail when the guidance is published. I personally think in relation to age, I obviously having a very small toddler myself, I know that younger children do struggle in terms of social distancing and maintaining that social distancing. So there might be some consideration in terms of who may want to come and pray, and it's unlikely probably if you're very young that you would do that individual prayer. There's also the question of age in relation to vulnerability, and we know that older people are disproportionately affected and are more likely to suffer more severe consequences of COVID. So there is again that sense of individual risk assessment based on your circumstances, but I don't know if other colleagues know any more detail about age restrictions. No. So I think that as the leader said, as soon as we know more guidance, we can make sure that if these questions that are coming through have been addressed through that, we can send that out. Another question here, which is what happens if more than 6 people are in the building for private prayer at the same time? Wendy, I think you covered that in your answer previously, but if you just want to sort of restate the position in relation to numbers.
Yeah, so as I understand it in the guidance, there isn't a restriction in relation to numbers that is coming out for places of worship being open. It's all about looking at the individual place of worship and ensuring that there's sufficient social distancing. So the 2 meters between people who will be attending for their individual worship. So it will depend on each building.
Thank you. And Wendy, I think it's over to you again. We've had a couple of questions regarding funerals in relation to funerals within buildings. So can funerals take place within mosques next week in terms of funeral prayers? Do you want to come in on that one?
Yeah, I can do. As I understand it, the government has taken into account the fact that the grieving process is really an important process for people to go through for their own health and well-being, and that funerals can take place, but with restrictions in relation to who can actually attend, and that's limited to funeral directors, to the chapel attendants, members of the person's household, and that's restricted to close family members. Or if they're unable to attend, then close friends. And it's quite clear that you should not attend if you have any symptoms, or if you're isolating or shielding. And again, there's requirements for hand washing facilities and social distancing throughout.
Thank you. Okay, one for Jane now. Jane, can individuals utilise toilets and ablution facilities assuming the recommended cleaning is taking place?
Yes, as long as obviously those you're only using one cubicle, you know, in the next cubicle next door, because it may not be 2 meters is not being utilised. But yes, you can use the toilet facilities.
Okay. What is the guidance regarding giving lifts to people not from your household to get to the places of worship? Two shaking of heads there. I think one of the reason that it's a no is because it's very difficult to maintain a 2 meter distance in a car. Obviously, cars equally are not I mean, you can have the windows open, but they don't have the right ventilation in terms of keeping people safe. So it's not recommended to take people who are not part of your household and give them a lift. Okay, there's a couple of comments from people who are saying that the change of date to the 13th has been on the BBC One update while we've been online. So as the leader quite rightly said at the beginning, the guidance does change a lot of the time. So if that is the case, then I'm hoping that the guidance comes out very quickly then, given that's only in 2 days' time. Okay. There's a question here that says if social distancing is adhered to, then are communal prayers permissible? I think we covered this at the beginning, which is about the guidance is going to state that this is about individual prayer only, not prayers that has been led or in a congregation. So that is a no. Okay, I think that's everything that I've covered already, Leader, if that's okay with you. I mean, obviously there will be opportunities for people to ask more questions, as this won't be the only time we do this, as you said at the beginning.
Thank you very much. We've been joined by our Chief Exec, who's been excellent, and she's been going from one meeting to another, so I'm really appreciative that she's actually joined us from another important meeting. So before I make some closing remarks, what I ask the Chief Exec, Jackie Gedman, to do is just say a few words in terms of where we are at regarding the faith sector generally, and anything else she wants to say regarding COVID generally, and what we need to do in terms of moving forward, because that community, faith-based, voluntary capacity is so important in whatever we do, part of the overall totality of a person's well-being. So Jackie, over to you. Thank you.
Hi, everybody. I was about to say good morning, and then I realised just how late it is. So good evening to everybody. I just want to say a few things, and apologies if the leaders said some of these things because we haven't had a chance, obviously, to catch up. But I think the first thing is a huge, huge, huge thank you on behalf of the council for everything that you've done through the COVID pandemic. It has been absolutely mind-blowing, actually, how great the faith and voluntary community have pulled together and done amazing things. Moved mountains seems to be my phrase of the week, but we have moved mountains in the past few weeks, and we certainly couldn't have done that with you. And I know that all the councillors really, really appreciate that. But more important than that, I think our communities do too. I also want to say what an incredibly challenging time. I've been in local government for 30 years. I know it's hard to believe, but I've been in local government for 30 years and I have never been through anything like this. But it has been the worst of times, but also the best of times, for the reasons that I've just described about seeing people pull together in a way I've never seen before. But we have some big lessons to learn through the COVID pandemic, and so many of them I think that we're really keen that we grab and we make sure that we make a difference. So if you want a real life experience of the impact of inequalities, just look what's happened through COVID. And we're really, really keen as we move out of the COVID pandemic immediate response into what we describe as living with COVID for a while before hopefully we move to a new type of world. What we're really keen to do is to make sure that we learn those lessons and that we learn them well. And that's not from a top-down approach. That is certainly working with our communities, working particularly with the faith sector about what more we can do to improve inequalities and to improve people's lives. So my plea is that we, and it was really helpful that we were having this webinar today, is to ask you whether you would like to get involved in that with us. We're really keen. This is not a council-led. This is something that we want to engage really broadly on. And what we're looking for is volunteers really to do another one of these, but basically it will be focused not on how you reopen, but more focused on what are the lessons that have been learned. So a bit of reflection, but also how we move forward, how we move into recovery, and how we do the right thing for all of our communities. You know, we live in a fabulous place. It's a very, very diverse borough. It means there are lots of challenges and lots of opportunities. And I think that I hope what you're hearing from us is a real openness to make sure that we were great before, but we can learn an awful lot and do even greater things in the future. So if you'd like to get involved, we're not putting pressure on you to do so. I'm genuinely hoping the majority of you will. Then could you email the leader or myself, and we will make sure that we're very quickly we produce another opportunity to get together to discuss COVID. Thank you so much. Thank you, leader.
Thank you, Jackie, and thank you once again for joining us. We really appreciate the hard work yourself and your team are doing in mobilising that community and faith sector, which is so welcome. Just before I make some closing remarks, we didn't touch on shielding, and I think some of the questions that were raised, especially around age, and the questions didn't come out, but also in terms of vulnerability and underlying health conditions. We need to be absolutely clear that there are people out there who have been classed as shielded by the government. Nationally, there's in the region of 1.5 million. I believe that figure has gone up, and locally that equates to a good few thousand. And if anybody still feels that they need to be shielded, they can go and see their GP, and the GP can put them on that list, and there will be some extra support that can be targeted toward that individual. But one of the things that we have to bear in mind is, despite whatever happens, the cohort of people who are shielded are probably the most vulnerable in terms of getting, basically a high risk of dying. That's the bottom line, because this is a life and death matter. So we just need to bear in mind. I'm sure in your own congregations, irrespective of which faith organisations you belong to, you will have that detailed knowledge at a local level. So it's important. Part of our faith, in terms of whatever faith you come from, is to safeguard life. And I know that the work that you people do in terms of your own congregations, you do look after the people who are the most vulnerable. So again, if there is something that we can do to work with you on that, I'm sure we will be open to talk on that. Without further ado, I don't want to say too many things, but just once again, just to reiterate, a huge thank you. Because without you out there providing that local leadership, we will not be here. It's only through that team effort that we can get through this crisis together. Government can churn out loads of legislation, but if the will and the commitment and the hard work and dedication isn't there, and people like you who are putting themselves in harm's way, then we would not be where we are. We want to make sure that the excess deaths remain below where they are. We don't want to spike in deaths, especially within the communities that we are looking at in terms of most vulnerable. We do want to continue these conversations. We do want to continue these webinars. Jackie is genuine in terms of when she says that our offices are up to it to make sure that we actually engage as many people as we can. We want to make sure that the recovery is done in the correct way. And despite the economic impact and everything else, like I said earlier on, faith plays a very important part in a lot of people's lives, because that spirituality and that support and that mental well-being is so important, and that's where the faith sector will have to, and I'm sure they will rise to the challenge in providing that comfort to our communities through whatever spirituality you wish to focus on. Just to also reiterate, any feedback that comes forward, I'm and myself and the chief exec, and all the senior management team, we do have regular conferences with ministers and secretaries of state. We do keep on raising the issues you raised to us. We do exactly know where you're coming from. It is difficult. It is extremely difficult, but we live in exceptional times. But please be assured, we are continuing to raise the issues you raised with us direct to government, and you've seen examples of that in the past. But having said that, we also have to understand that we have to listen to our experts and we have to safeguard lives, and that is the bottom line for us. So once again, thank you very much, and once again, thank you to all the panel members. Appreciate your time. Thank you for everybody who's taken the time out to listen to us, and thank you for your questions, and let's continue this dialogue. Good night.
No.
Night.
Thank you.